preface my statement with admitting that I don't even vote in this district. My husband and I came in from Franklin County, but we're here and we support Ed for the simple fact that when he gets to Congress, whatever he does is still going to affect us. Aside from that, we're all hearing about cuts to Medicare. Well, I have right now in my hand, I've got an EOB from Medicare, and I've got the EOB that matches it from our supplemental insurance. My husband's a cancer patient. He is in remission, thank God, but he had to have his recent checkup. And what that entails a CT scan and or a PET scan every so often to make sure that this cancer hasn't risen up again. And what I want to share with you, I don't know how they ever think they're going to cut Medicare. His bill that he had for his last CT scan and everything, it amounted to $5,850. This is the Medicare's EOB right here. I want you to know that Medicare only approved 10.4% of that bill, which that actually comes up, they approved $611.02. And then they only paid 8.4%, leaving our supplement to pay 2%. So now the hospital is left holding the bag of $5,238 and some odd cents for that bill. Now that is money that we're all going to make up somewhere else. Younger people are going to make up someplace in their increases in payments and their premiums and all. But how can they possibly ever say they're going to cut as much as they are out of Medicare when they're only approving 10% now to begin with? Okay. So it's just going to be, you know, really downhill for us.
Thank you for your comment. Let me say one thing about that we need to know. Again, one of the things that is positive about the last campaign for president was there was a lot of talk about transparency. Most people, yeah, the talk was good. But most people believe, and I'm a strong proponent of transparency for actual cost, so that we see what people are paying, who's paying what. One of the problems in the marketplace is that Medicare and Medicaid distort what they actually pay, and hospitals then have to inflate what they bill, and things are really not actual cost. And that's what happens when the government gets in the business of trying to manage such a difficult thing as healthcare. So transparency is actually a big part of what we need, you know, to do better. But as we've seen, people can say, I want to be transparent, and they can mean that they just want to say transparency over and over again because they know it sounds good. So there's a real problem, but you have to be willing to bite the bullet, be transparent, and show the cost. It's going to be, the insurance companies aren't going to like it, the hospitals and others. So one thing I meant to say is, don't get mad at me, I meant to say is we try to keep our comments to about 3 minutes if you can, or questions, so that we get through as many as we can. And I know I'm already the biggest violator of that, but